Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
The client with an Axis 1 diagnosis of schizophrenia, undifferentiated type, is acutely psychotic and exhibits religious delusions and hallucinations, loose associations, and concrete thinking. When the nurse offers a client her medication, the client states, "I don't need that. God will heal me." The nurse should respond to the client by saying, 1. God helps those who help themselves. 2. God wants you to take your medicine. 3. God is important in your life, but the medicine will help you too. 4. This medicine will help clear your thoughts and decrease anxiety. The correct answer is 3. Stating that God is important in the client's life recognizes the client's cognitive and perceptual disturbances and level of anxiety, and acknowledges the client's message in a respectful and neutral manner, while adding that the medicine also will help, clearly and directly states the need for medication, stating, God helps those who help themselves, challenges the client, stating, God wants you to take your medicine is deceitful, stating, medicine will help clear your thinking and decrease anxiety, would be helpful to the client later when she is less acutely psychotic and anxious. What is the most appropriate long-term goal for an outpatient client with chronic undifferentiated schizophrenia who has been withdrawn from friends and family for 3 weeks? 1. Calling the client's mother once a day. 2. Attending day therapy 3 times a week. 3. Allowing 2 friends a visit every day. 4. Remaining out of bed for 10 hours a day. The correct answer is 2. Attending day therapy 3 times per week is a long-term goal that will show the most progress in overcoming withdrawal. The client's calling his mother is a first step in getting out of severe withdrawal. Allowing 2 friends to visit every day would be appropriate if the client is successful with calling his mother once a day. Insufficient information is presented in the scenario to indicate that excessive sleep is a problem. A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Noncompliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. Which of the following areas is a priority to evaluate when completing discharge planning for a client who has had a lobectomy for treatment of lung cancer? 1. The support available to assist the client at home. 2. The distance the client lives from a hospital. 3. The client's ability to do home blood pressure monitoring. 4. The client's knowledge of the causes of lung cancer. The correct answer is 1. Because clients are discharged as soon as possible from the hospital, it is essential to evaluate the support they have to assist them with self-care at home. The distance the client lives from the hospital is not a critical factor in discharge planning. There are no data indicating that home blood pressure monitoring is needed. Knowledge of the causes of lung cancer, although important, is not the most essential area to evaluate given the client's postoperative status. A client who underwent a lobectomy and has a water-sealed chest drainage system is breathing with a little more effort and at a faster rate than 1 hour ago. The client's pulse rate is also increased. The nurse should 1. Check the tubing to ensure that the client is not lying on it or kinking it. 2. Increase the suction. 3. Lower the drainage bottles 2 to 3 feet below the level of the client's chest. 4. Ensure that the chest tube has 2 clamps on it to prevent air leaks. The correct answer is 1. In this case, there may be some obstruction to the flow of air and fluid out of the pleural space, causing air and fluid to collect and build up pressure. This prevents the remaining lung from re-expanding and can cause a mediastinal shift to the opposite side. The nurse's first response is to assess the tubing for kinks or obstruction. Increasing the suction is not done without a physician's prescription. The normal position of the drainage bottles is 2 to 3 feet below chest level. Clamping the tubes obstruct the flow of air and fluid out of the pleural space and should not be done. A client undergoes surgery to repair lung injuries. Postoperative prescriptions include the transfusion of 1 unit of packed red blood cells at a rate of 60 milliliters per hour. How long will this transfusion take to infuse? 1. 2 hours. 2. 4 hours. 3. 6 hours. 4. 8 hours. The correct answer is 2. 1 unit of packed red blood cells is about 250 milliliters. If the blood is delivered at a rate of 60 milliliters per hour, it will take about 4 hours to infuse the entire unit. The transfusion of a single unit of packed red blood cells should not exceed 4 hours to prevent the growth of bacteria and minimize the risk of septicemia. Which of the following statements should the nurse use to describe to the parents why their child with leukemia is at risk for infections? 1. Play activities are too strenuous. 2. Vitamin C intake is reduced over a period of time. 3. The number of red blood cells is inadequate for carrying oxygen. 4. Immature white blood cells are incapable of handling an infectious process. The correct answer is 4. In leukemia, the number of normal white blood cells that are capable of fighting an infection is decreased. Although there is an increased number of immature white blood cells, they are unable to combat infection. Therefore, a child with leukemia is subject to infection. The major morbidity and mortality factor associated with leukemia is infection resulting from the presence of granulocytopenia. While increased activity may cause fatigue, it does not put the child at risk for infection. Vitamin C intake should not decrease if the child has adequate dietary intake. Decreased red blood cells are not directly caused by infection. An infant has been transferred from the ICU to the pediatric floor after undergoing surgery to correct a heart defect. Which tasks can the charge nurse delegate to the licensed practical nurse? Select all that apply. 1. Administering oral medications. 2. Administering IV morphine. 3. Obtaining vital signs. 4. Morning hygiene. 5. Circulation checks. 6. Discharge teaching. The correct answers are 1, 3, and 4. The RN scope of practice includes assessment, planning, implementing, and evaluation. Only aspects of care implementation may be delegated to the LPN, and the exact skills that may be delegated vary by state and institution. In general, LPNs have been trained to perform the tasks of administering oral medications, performing hygiene, and recording the intake and output. LPNs may also take vital signs to gather data, but the RN must interpret the data. Administering IV morphine requires assessment of the client's respiratory status before, during, and after procedure. It should be done by the RN. Circulation checks are assessments the RN should complete. After dilation and curettage to evacuate a molar pregnancy, assessing the client for signs and symptoms of which of the following will be most important? 1. Urinary tract infection. 2. Hemorrhage. 3. Abdominal distension. 4. Chorioamnionitis. The correct answer is 2. After dilation and curettage to evacuate a molar pregnancy, the nurse should assess the client's vital signs and monitor for signs of hemorrhage, because the surgical procedure may have traumatized the uterine lining, leading to hemorrhage. Urinary tract infections, not common after evacuation of a molar pregnancy, are most commonly related to urinary catheterization. Typically, urinary catheters are not used during evacuation of a molar pregnancy. The client should not experience abdominal distension because the contents of the uterus have been removed. Chorioamnionitis is an inflammation of the amniotic fluid membranes. With complete mole, no embryonic or fetal tissue or membranes are present. A client at 4 weeks postpartum tells the nurse that she can't cope any longer and is overwhelmed by her newborn. The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking, and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait. Asking another staff member to stay with the client, or saying nothing is not helpful. For the client with catatonic behaviors, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? 1. The client can move all extremities occasionally. 2. The client walks with the nurse to the client's room. 3. The client responds to verbal directions to eat. 4. The client initiates simple activities without directions. The correct answer is 4. Although all the actions indicate improvement, the ability to initiate simple activities without directions indicates the most improvement in the catatonic behaviors. Moving all extremities occasionally, walking with the nurse to the client's room, and responding to verbal directions to eat represent single steps toward the client initiating her own actions. The director of a workshop program tells a nurse that the client with schizophrenia had done well for 6 months until last week, when a new person started at the workshop. This new person worked faster than the client did and took his place as leader of the group. Based on this information, which of the following interventions is most appropriate? 1. Make a home visit and tell the client that if he does not return to the workshop, he will lose his place there. 2. Ask the director to assign the client to another work group when he returns to the workshop. 3. Make an appointment to meet the client at the mental health center and ask him about the situation. 4. Arrange the placement of the client in a skill training program. The correct answer is 3. The most therapeutic action at this time is for the nurse to make an appointment with the client at the mental health center to explore his feelings and behavior. Doing so acknowledges the client's importance and makes him a partner in resolving the problem. The nurse needs to determine what is going on in the situation first, and then plan accordingly. Threatening the client with loss of position, asking for a new assignment for the client, or arranging for the placement of the client in a skill training program is inappropriate and premature. Which of the following would be a significant intervention to help prevent lung cancer? 1. Encourage cigarette smokers to have yearly chest radiographs. 2. Instruct people about techniques for smoking cessation. 3. Recommend that people have their houses and apartments checked for asbestos leakage. 4. Encourage people to install central air filters in their homes. The correct answer is 2. Epidermoid cancer involving the larger bronchi is almost entirely associated with heavy cigarette smoking. The American and Canadian Cancer Societies report that smoking is responsible for more than 80% of lung cancers in men and women. The prevalence of lung cancer is related to the duration and intensity of the smoking, so nurses can best prevent lung cancer by persuading clients to stop smoking. Chest radiographs aid in detection of lung cancer. They do not prevent it. Exposure to asbestos has been implicated as a risk factor for lung cancer, but cigarette smoking is the major risk factor. There are no data to support the use of home air filters in the prevention of lung cancer. Which of the following should be readily available at the bedside of the client with a chest tube in place? 1. A tracheostomy tray. 2. Another sterile chest tube. 3. A bottle of sterile water. 4. A spirometer. The correct answer is 3. A bottle of sterile water should be readily available and in view when a client has a chest tube, so that the tube can be immediately submersed in the water if the chest tube system becomes disconnected. The chest tube should be reconnected to the water seal system as soon as a sterile functioning system can be reestablished. There is no need for a tracheostomy tray, another chest tube, or a spirometer to be placed at the bedside for emergency use. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following complications? 1. Emboli formation. 2. Fluid volume overload. 3. Red blood cell hemolysis. 4. Allergic reaction. The correct answer is 2. Too rapid infusion of blood or any intravenous fluid can cause fluid volume overload and related problems such as pulmonary edema. Emboli formation, red blood cell hemolysis, and allergic reaction are not related to rapid infusion. Which of the following beverages should the nurse plan to give a child with leukemia to relieve nausea? 1. Orange juice. 2. Weak tea. 3. Plain water. 4. A carbonated beverage. The correct answer is 4. Carbonated beverages ordinarily are the best tolerated when a child feels nauseated. Many children find cola drinks especially easy to tolerate, but non-cola beverages are also recommended. Orange juice usually is not tolerated well because of its high acid content. Tea may also be too acidic, and many children do not like tea. Water does not relieve nausea. The nurse is assisting with conscious sedation for a 6-year-old undergoing a bone marrow biopsy. The nurse's most important responsibility during the procedure is to 1. Administer the topical anesthetic. 2. Keep the parents informed. 3. Monitor the client. 4. Record the procedure. The correct answer is 3. During conscious sedation, the client may lose protective reflexes, and adequate respiratory and cardiac function may be impaired. At every procedure, there must be one healthcare professional whose sole responsibility is to monitor the client. Topical agents must be given in advance of the procedure to be effective during the procedure. The nurse would not leave the child to speak with parents, while the procedure will be documented according to the facility's protocols. Proper monitoring of the client is the intervention most associated with reducing risks.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.